Good afternoon, everyone, and welcome to the second session of today for Kidney Action Week. I am Melanie Paris, and I am Senior Director of Education and Strategic Outreach here at American Kidney Fund. I'm really looking forward to moderating this session as we talk about transplant and COVID-19, and also living with kidney disease and COVID-19 in the environment we are in today, as we speak with infectious disease experts and transplant experts and get their opinion and insight on what it means to return to normal for those who are immunocompromised. I am pleased to introduce as one of our panelists, Dr. Sapna Mehta. Dr. Mehta is a transplant infectious disease physician and associate professor of medicine at the NYU Grossman School of Medicine, where she established and currently directs the Transplant Infectious Disease Program in the NYU Langone Transplant Institute. Dr. Mehta serves as the principal investigator for the NIH-funded Hope in Action clinical trial, which supports transplantation of organs from HIV-positive donors to HIV-positive recipients, and clinical studies in the areas of epidemiology and COVID-19 in the transplant population. Dr. Mehta is also the clinical director for the NYU Langone Transplant Institute, in which she oversees the clinical enterprise of solid organ transplant in partnership with Dr. Robert Montgomery. Welcome, Dr. Mehta. So glad you're joining us today. Later in the discussion, Dr. Robert Montgomery will join us. I'll introduce him now so you'll know who he is when he does join us. He is chair of the Department of Surgery at the New York University Langone Health and director of the New York University Langone Transplant Institute. Dr. Montgomery is part of the team that developed the laparoscopic procedure for live kidney donation, a procedure that has become the standard throughout the world. He's also credited in the 2010 Guinness Book of World Records with the most kidney transplants performed in one day. Dr. Montgomery is considered a world expert on kidney transplantation and is referred the most complex patients from around the globe. Dr. Montgomery also became the recipient of a heart transplant himself in 2018. So we'll get started with the presentation, but just as a reminder, we will have a Q&A at the end of this session where the panelists will be answering your questions about COVID-19 and kidney disease. If you're joining us on Facebook, you can type your question or comments into the window next to or below the Facebook Live audio. If you're joining us from the Kidney Action Week website, you can type your question into the chat box to the right, and we'll answer as many questions as we can when we get to the Q&A session. You don't have to wait until the end to type your questions in, so you can start and ask your questions as they come to you. So thank you for joining us, Dr. Mehta. I'm so glad to have you.
Thanks. Happy to be here as part of Kidney Action Week.
So there's a lot of information about COVID out there, lots of people living with kidney disease and a transplant. So could you please explain to us why kidney transplant recipients are especially vulnerable to COVID-19 infection?
Yes. So transplant recipients are more vulnerable to infection in general due to lifelong use of medications that prevent rejection. Essentially, they're receiving an organ, be it a kidney or a different organ from someone else's body, and our immune systems are set up to fight against anything that is foreign. And so these anti-rejection medicines, which patients take lifelong after transplant, work by weakening the immune system, so the immune system doesn't do that, in essence, fight off the new organ. But as a result, our immune systems after transplant don't fight off infection as well as a normal immune system does as a result of these medications. So infections, including COVID-19, can progress more rapidly because of the weakened immune system and be more severe and present in atypical ways compared to patients with a normal immune system.
Okay, thank you so much for that overview. It's really important just to get the basis for everything. So kidney transplant recipients and individuals living with kidney disease may have already received the COVID-19 vaccine, but they may also benefit from opting to receive monoclonal antibody treatment. Dr. Mehta, can you explain what are monoclonal antibodies and how can they be helpful a helpful COVID treatment for immunocompromised individuals?
So I think it might be helpful to think about, our immune system in general has a variety of ways to fight off infections. In terms of monoclonal antibodies are antibodies that are made in the lab that target the spike protein of the virus that causes COVID-19, which is the SARS-CoV-2 virus. And I think many people over the last 2.5 years have learned about this spike protein on the outside of the virus. You can see that in the illustration here. And what this achieves in terms of the antibody targeting that spike protein is it blocks the virus from entering cells in your body, which limits the amount of virus in your body, and therefore leading to milder symptoms and lowers your chance of requiring hospitalization. And this is the goal of monoclonal antibody treatment and potentially prevention as well, to lower the burden of COVID-19.
Thank you very much. Again, if you're just joining us, welcome to this session, COVID-19 Return to Normal and the Immunocompromised. As a reminder, we will have the Q&A at the end of the session. You don't have to wait to type in your questions. You can just go ahead and type them in right now. So, Dr. Mehta, in 2021, December, the FDA authorized Evusheld, you can correct me on the pronunciation for that, please, to be used as a medication for people with immunocompromising conditions. Could you explain what this medication is and why it might be an option for kidney transplant recipients?
Yes, so Evusheld is a combination of two monoclonal antibodies that have been developed for COVID-19 that are administered as 2 injections, one after the other. And the 2 monoclonal antibodies that make up Evusheld are tixagevimab, which is a mouthful, and cilgavimab. So this combination is the first authorized monoclonal antibody for prevention of COVID-19 prior to exposure, before you've been exposed to someone with COVID. And this is different from the monoclonal antibodies that have been approved for treatment over the last 18 months, of which we've had several. And again, the goal here is to give this monoclonal antibody to have patients with a weakened immune system be better prepared should they be exposed to COVID. So as you said, it was authorized for this emergency use by the FDA in December. So it is an investigational medication. In terms of potential side effects, the most common, as with any injection, is swelling, pain, or potentially even infection at the injection site, and that comes with getting the shot. Most side effects are mild, but it is important to monitor for side effects and to report to your doctor. And this is something we want patients to do with any investigational or new medication. And then also it's something that, most places that administer Evusheld have a system for following up with patients after the injection to see how they're doing.
So just to reiterate, this is not a substitution for the COVID vaccine.
That's correct. Evusheld should be given after vaccination is completed. Essentially, you're giving your body another layer of protection should you become exposed to COVID to prevent infection.
Thank you so much for explaining this. As you know, there's so much information out there about COVID-19, the vaccines. So this was very helpful. So if someone is eligible for Evusheld, how long after getting the COVID-19 vaccination should they wait before getting Evusheld?
So right now, the recommendation is to wait 2 weeks after your last vaccine dose before receiving Evusheld injection.
Okay, thank you. So that's very helpful. So in addition to Evusheld and antibody treatments, there's also oral medications available. Could you tell us a little bit about the oral medications and if there are any considerations for transplant recipients or people living with kidney disease?
Sure. So there have been several different antivirals that have been developed for treatment of COVID-19. Paxlovid is one example, and these are antiviral medicines that can be taken by mouth. They're pills to help, again, keep infection from progressing and becoming more severe. It's really important to note that while this can be an effective treatment for COVID-19, the medications have interactions with other medications. So anyone who's taking medications should ensure that they review with their provider before starting a medication such as Paxlovid, whether there are any interactions with their medicines they're already taking. And I will say that that is one of the reasons why we have not used this for the large part in transplant recipients, because most transplant recipients are taking a medication that's part of their anti-rejection medicine that has a pretty significant interaction with the antiviral Paxlovid. So bottom line is it may be an appropriate treatment for you depending on your medical conditions, and important to review that with your provider and make sure that, in particular, if you have different providers taking care of you and prescribing different medicines, that whoever is evaluating you for an oral antiviral treatment for COVID is aware of your full medication list to check that it will be safe.
Thank you for that. I was going to ask, if you have several providers, which provider is best positioned to give you the information and to monitor whether or not it's a safe option for you?
And these are, as long as your provider has the full list of your medications, I always suggest to patients they keep a list, whether it's on an index card, something laminated, something you can keep in your wallet if you don't have all of your care in the same place. And then that is something that any provider can quickly put into. We have many tools that check drug interactions thoroughly, that once they have that accurate list can quickly check that for you.
That's really good advice. Would a pharmacist be helpful in that regard as well?
Absolutely, absolutely.
Thank you. So again, if you're just joining us, you can drop your questions in the chat or in the space available if you're on Facebook. So Dr. Mehta, COVID rates have been going up and down, depending sometimes on what part of the country you're living in. And we've all heard the term, return to normal, but many immunocompromised individuals still need to follow strict guidelines. What would you tell someone living with a transplant or kidney disease, how they navigate this return to normal space for themselves? And what about those of us who live with or close to or work with people who are immunocompromised?
It's been really challenging the last 2.5 years, and certainly this has been a challenge that's gone longer than I think most of us expected back in 2020. I think that we've learned a lot about COVID, even though we are still learning things about the virus, and in particular how it affects people with weakened immune systems. So in my conversations with my patients and their families, we focus on prevention of infection, some of what we've been talking about today, what we know and what we've learned about this virus in terms of how it passes from person to person. And so, there's the fundamentals of reducing your risk by, staying away from people while they're ill, distancing, as you will, from people until they are better. And that's something that our transplant patients and many patients with a weakened immune system from any medical condition are somewhat attuned to doing even before COVID, because that is a part of living with a transplant, in that, distancing yourself while someone is ill. Other things we've learned about wearing a mask in crowded places is still something I advise to my transplant patients, again, because of their weakened immune system, and in particular when cases of COVID are high in their particular community. So that varies depending on where you are, and even, what your interactions in the community you are. If you are someone who's commuting on public transport to on-site work that involves interactions with large number of people, your risk of exposure is different from someone who may be retired or working remotely from home. And so those are the details that I get into with my patients. But again, we have learned that masking helps reduce transmission. And I think that is still important in indoor public spaces, particularly that are crowded. Vaccination is key in lowering the risk of developing severe COVID, and that is a primary goal here in terms of preventing illness and preventing death from COVID, so that even if you are infected, you will hopefully have a milder case of infection. So we focus on getting everyone vaccinated according to the recommended intervals of boosters, and we know that that is evolving too as we learn more about immunity from COVID vaccines and how long that immunity may or may not last in people with weaker immune systems. And then finally, really seeking care, getting tested if you have symptoms or if you've been exposed to someone through a close contact, so that, again, you can know if you've been infected and receive the appropriate treatments to prevent getting sick or sicker if you've already developed symptoms. And I think those same recommendations apply to our family members of our transplant patients, those living with people with weak immune systems, to, get themselves tested if they feel unwell for their own health, but also so they don't pass it to somebody that they live with that might have a more severe illness if they get infected. We recommend that all of our household members of our transplant recipients get vaccinated to protect themselves and to protect their loved one who is immunocompromised. And again, limiting their exposure through the same measures that have been, shown to reduce risks, such as masking and adjusting behavior, as I like to say, during periods when cases are particularly high.
Now, that's great information. So again, there's so much information out there. What's the best way a person can stay up to date with the most reliable, most current information about the case numbers, the best treatments, the latest treatments, especially for someone who has kidney disease or living with a transplant?
Sure. So I think, our public health systems and have done a really great job of tracking the epidemiology, and basically that's the case rates of COVID. So I know here in New York, the New York City Health Department has a fantastic portal on their website that anyone can access, where you can look at the case rates that are up to date. You can break it down by the borough of the city, zip code, neighborhood, and most public health departments have that. So I would first suggest looking to your local, whether it's the city or the state public health department's website, and play around with the tools about how you can look at the data, or even potentially subscribe to any email updates if that's something that you would like to have real-time information on. I also think that staying up to date with the recommendations here in the United States for vaccination as per the CDC is important, and you can do that again by going to the CDC website. And we know that those recommendations change and pivot as we get more information about vaccinations and immunity, and that's both for adults and children. I think talking to your provider based on your own medical condition, what your own risk factors may be based on your age, your health, medications that you take, to know, what they recommend for you, and where locally in your region are the best resources to know where to get tested, where to present for treatment. There is a national COVID-19 therapeutics locator that I think we'll be providing on one of our last slides. It's a great tool to, again, by zip code, find where you can get, be it monoclonal antibody or Paxlovid, where these treatment options are available to you. And most likely your provider is aware of this too, but you with your provider or a team as you navigate sort of how to quickly and promptly get access to treatments you might need.
Thank you for that. It's just so important to get the right information and the most accurate information. So thank you for giving those resources. So another environment, people have to go back to work. There's some people who are not working from home. Some people have to work, interact with the public. What can we do? Say we're coworkers of someone. Or more importantly, what conversations can someone have with an employer or coworkers about, their condition and how to keep them safe in that environment?
Right. So I know one of my goals in my practice has been to help our patients, get back to, as we said, normal. And that often for patients is getting back to their normal work life. And, it's important to feel, that you're able to get back to your profession, engaged and a part of it in the way that you would like. And, that's why I have focused, on making sure that our patients have been up to date with their vaccinations, offering them Evusheld for prevention so that they can be back in the world as they would like to as safely as possible. In terms of your question of, so I think that's an important first step for patients to do in terms of getting back to normal is to discuss that with their provider and make sure that they have looked at all of those, medical tools available to them to limit the risk of exposure. Then in terms of conversations with others, I think it's a very personal choice how much of your own medical history to provide in your workplace. And so that is very individual. And I think that if someone would like to have those conversations with their employer or their colleagues, to think about sharing why they would like to be back in the workplace and how they'd like to stay safe so that they can remain in the workplace. And if there are specific accommodations that they think might be helpful, to perhaps talk to the direct supervisor first. I think many workplaces now have an optional mask requirement. Sometimes it's there's not a mask policy in many parts of the country. That can be challenging. Hopefully, work environments are supportive enough that if someone chooses to wear a mask, that is welcome, and that is something that I know many immunocompromised patients choose to do. But that might be a conversation to have. If there are travel-related risks related to work or large meetings, to talk again with your supervisor about how you'd like to participate and what other options for you there may be to do that safely. Whether it's having an ability to join remotely if it's going to be a large gathering, or if there might be, as we get into some warmer months here, options for having some of these meetings take place outdoors or in large ventilated spaces.
That's just really great information. Sometimes those conversations might be difficult for people to have, but knowing that you can perhaps go to your coworker, employer, and have a conversation about your situation and how to stay safe is really key. So just a question about the medications or the treatments available, Evusheld. You have to get your vaccine first, but what about boosters? How does that work in combination with Evusheld?
Sure. So boosters is a bit of a moving target as we continue farther and farther into the pandemic. Really for immunocompromised patients, we're out to recommendations from the CDC for a fifth dose, so multiple boosters. What we're doing for our patients is looking at the timing of where they are between the booster doses as per the current recommended schedule. And if it's a few months until the next booster, then Evusheld really makes sense right now for people who are wanting to reduce their risk. Again, someone like you just said, who's working, someone whose family is working, who has many household members that are, interacting in the community and in the workplace. And so that's sort of what we've been recommending. Whereas someone who maybe is a few weeks away from the time for their next booster should wait for that booster to be done and then wait the 2 weeks before getting Evusheld. So that's sort of how we're navigating that.
Okay, great information, because I know there's a lot of questions about the booster, if I've had the vaccine, when does all this fit together? Dr. Montgomery has now joined us. Thank you for joining us, Dr. Montgomery.
How are you? Sorry I'm a bit late.
Oh, no worries. I did give an introduction before you arrived, but I'd love to do it again just to set the tone and for people who maybe joined us late. Dr. Montgomery is the chair of the Department of Surgery at the New York University Langone Health and director of the New York University Langone Transplant Institute. He was part of the team that developed the laparoscopic surgery or procedure for live kidney donation, a procedure that has become standard throughout the world. He is also credited in the 2010 Guinness Book of World Records with the most kidney transplants performed in one day. He is considered a world expert on kidney transplantation and is referred the most complex patients from around the globe. Thank you so much for joining us. Oh, and one other important note, Dr. Montgomery became a recipient himself of a heart transplant in 2018. So that's great news. Thank you so much for joining us.
It's great to be here. And I know that Dr. Mehta has really, given you the critical information and kind of set the scene for our discussion about, the patient perspective on all this.
Absolutely. Learned some fantastic information. So, Dr. Mehta, do you have questions for Dr. Montgomery that you would like to pose?
Yes, so we've spent some time talking about, preventing COVID-19, returning to normal, which includes returning to work, but also spending time with loved ones, and how monoclonal antibodies, in particular Evusheld, that's been approved for prevention, can play into that. So obviously, return to work was pretty much constant factor for you since the start of the pandemic. So let's start a bit about, what it was like for you in terms of as vaccine became available and as COVID continued, how you were thinking about your own risk as a transplant patient.
So, I was among the initial healthcare workers who got the vaccine in December of 2020, so right before Christmas. And then I had my second dose of Pfizer the first week of January. And then, I was I think I was the first person to go into the Hopkins study. And we did determine very early that I had not had any response to the first 2 doses of the vaccine. And so NYU actually offered a 3rd dose very early. Before probably anyone was really thinking about that, because I did have, exposure at work and they were concerned. And so I received a 3rd dose and I did a crossover actually. At the time, the J&J vaccine had just come out, and that was all we had at the time that they offered it. So I got J&J and actually had a really nice response to that. Now, of course, that's not really recommended at this point, but again, we were learning about all of this as it was happening. So you have to remember that. But I did have a quite robust response. And, obviously we were all really looking forward to the vaccine, and it was an incredible disappointment, after those first 2 doses, when I realized that the thing that I had been looking forward to so much to, reduce the concern about an exposure actually wasn't effective for me. But I was very pleased when I did mount a response. And then I had a 4th dose sometime later. And I was part of actually the Hopkins trial and also a NYU vaccine trial. So both my antibody levels and my responses as far as T cells were being monitored pretty closely as part of these trials. And both trials did allow me to have that information. And so Dr. Mehta is actually my infectious disease doctor. And so we've been working very closely through all this. She's been very protective of me, I would have to say, as we've passed through, the various phases of the pandemic and this different strains, and just trying to respond to each of these new challenges. And she did recommend about 2 or 3 months ago the Evusheld as a bridge for me, through the summer, before the fall flu season starts and people go back inside again, and at which time I'll get a 5th shot. So that's kind of how we've played it as it's unfolded. And I knock on wood, I haven't had COVID yet, but I have really been able to kind of work through the pandemic. And I think what I would say is I'm probably very careful in my personal life, but obviously I have to take care of patients and I have to do what I do. So at work, I obviously wear a mask, and through much of the time wore an N95 mask. I had to get rid of my signature mustache because I needed to get a good seal. But it's really been, I know, for all patients who are immunosuppressed, a really concerning time. And there's been so many different recommendations that have been made, and some of the changes, I think, for transplant patients have seemed premature, and we've kind of had to go back out when suddenly no one was wearing masks, and get on airplanes when that requirement dropped. And it's been quite a couple of years, I would say.
Well, thank you so much for sharing that story. Dr. Mehta.
One of the questions that I get often from patients about Evusheld is the potential side effects. So earlier we talked about, the most common side effects tend to just happen at the injection site. But every patient who is offered Evusheld receives a patient information sheet. And, that does include information about how there's a potential, but not completely understood if it's, caused by Evusheld, but association with, cardiac events, meaning, heart-related events after Evusheld. And, this can sound scary. And I know that you and I talked about that, but how did you, in your personal decision-making, particularly as a heart transplant recipient, process that and come to your decision about whether to take Evusheld or not?
Well, my feeling throughout the pandemic has always been that the risk of me getting COVID and getting really sick and, possibly dying was always greater than the risks, the very rare, unusual, side effects. And I felt, after really examining the data from the initial vaccine trials, and then each of the trials that have come since, and just my knowledge of vaccines in general for transplant patients, that it was the right thing to do. And at each decision point, even when I was really among the first immunosuppressed patients, since there weren't any immunosuppressed patients that were in the original trials to get the vaccine, I still felt that my risk was much greater not having it than from the potential side effects. And I felt the same way about the monoclonal antibodies. And, I have had family members who have gotten COVID-19 that I've been very close with while they were infectious. And I did get also, Dr. Mehta, after a really close exposure to Delta, I did get the monoclonals, and I don't know, perhaps that protected me from getting COVID-19 at that point, because I really should have, by the level of exposure that I had. So I've just been going right along, and trying to take advantage of the technology that was available to me each step of the way, feeling very confident that that was far superior to, not having those opportunities. So that's how I've, thought about the risk.
Well, thank you so much, Dr. Montgomery. It's very, I think, interesting to have your perspective, both as a physician and also from the perspective of a transplant recipient. So that experience that you're sharing is so valuable to all of us.
Yeah, I mean, I've really benefited from, being a physician through this and a transplant surgeon. And, I'm aware of that, it was really something that allowed me to be able to understand a lot of this better than, a lot of my fellow patients. And there's so much misinformation out there that I know it's really, it's really a challenge for patients to try to separate, all of the things that are being said, some of which are, just not very factual from, from the truth of the science. And so, it has been a benefit to be able to really look at the data myself, but every step of the way, I've been sure that the right thing to do was to be protected, and that's how I've operated.
Again, thank you so much. Just a question from your personal experience. How have you stayed positive during COVID? How have you stayed encouraged? Optimistic. A lot of people have gone through fears and anxieties and not really sure what's happening sometimes. How have you been able to stay positive and just on the right track for yourself?
Yeah, I mean, I guess I'm a pretty positive person in general, so I will have to say that. But, we were in New York when this all unfolded, and it was very scary in the beginning. And, we saw a lot of transplant patients get really sick, and a lot of patients died. And, it was really what a, frightening and amazing time to live through. But I've always felt like, I guess that, because I'm a leader, and, I need to set an example, and I had to work and I had to lead, because there were very desperate times, in our hospital where we were running out of beds, and, we were really worried about all the things that we all were worried about in the very beginning, the resources and being able to care for all the patients. Fortunately, we navigated that somehow, and we're always able to give the best possible care, never had to compromise that. But because I was so involved in making sure that, that was the case, I think I was thinking about, my patients and other people throughout all of that. And maybe that helped. Just the fact that I was, not alone with my thoughts. I had to keep working, I had to keep doing, and, and being productive. So I had that advantage, I guess.
Well, I would just like to say thanks to both of you for providing care to all of your patients during really, really stressful time, especially in New York. I know that things were quite difficult and overwhelming. So just on behalf of patients and people, we just really want to thank you for all the work that you did and continuing to save lives. So
thank you.
Oh, go ahead, please.
Yeah,
sorry.
I was just going to say, I think, we should recognize that, that there was, a lot of people got very sick and people died, and it's a very sad time for those families. And we have, 1 million families that are, really been so profoundly affected by this disease. And it's really, something that is going to continue to affect us into the future, the trauma and, the fallout from all of this. We can't even really, I think, begin to understand what that's going to be. And I think, people, sometimes these things hit late too, and people should really, be conscious that if they need help in dealing with all this, they should seek it, because, everybody, we all as a country and in a world have been through something really, really dramatic and traumatic.
Well, thank you for sharing that. Would it be okay if we get to audience questions now? We have some that have come through, if you're ready.
Yes.
All right. So these are questions that have come in through our Facebook, YouTube, and also on the Kidney Action Week website. Again, if anyone has questions that you would like to ask, please put them in the chat, and I will pose the questions to our panelists. So a question that we have from someone with stage 3 kidney disease asks, should someone in stage 3 continue to take precautions like wearing masks in crowds? I don't know if you have any recommendations for indoor crowds versus outdoor crowds.
So, when we think about risk after COVID, getting infected with COVID, we know that people with chronic medical conditions, and that includes kidney disease, are at higher risk for getting sick. And so I think a few things factor into, your risk is the other medical conditions you may have. Some people with kidney disease are already immunosuppressed, depending on their other conditions. And then also your age. So I think that because older patients who are older tend to get sicker with COVID. So I think that it's, again, during a time when there are a lot of COVID cases in your community, it's certainly something we've had here in the Northeast for the last couple of months now. It would be prudent to wear a mask when you're in indoor crowded public spaces because of that proximity. And that's what we know about the virus in terms of how it passes from one person to another.
Thank you for answering that. Dr. Montgomery, any thoughts from you on this?
Yeah, so we do know that at least that, patients who have end-stage renal disease are at increased risk. And I'm sure that risk is, it's sort of a spectrum. And so someone who is CKD stage 3 would have some level of increased risk, over the general population. And I think, prudence, as Dr. Mehta said, particularly indoors, is important. I certainly still put a mask on when I go into a Starbucks or, walk indoors. And when I'm outside, I feel quite comfortable. And so I think it's a good idea if you have a chronic disease.
Thank you. The next question we have is about Evusheld. So they ask, for those of us who have had Evusheld, when will we need redosing? How long is it effective?
That's a great question. So based on the initial study that was done for Evusheld, the effect of the antibody likely lasts out to 6 months. What is still under study that we don't have results for is whether that's the same in people whom are immunosuppressed. So right now, the recommendation is to, consider redosing at 6 months. We really haven't reached that point, but we will soon this summer for the first batch of patients who received Evusheld. But I'm hoping that we'll have some of this data specifically on how long the antibody protection lasts in immunosuppressed patients soon to guide us there.
Thank you. Dr. Montgomery? Yeah, no, I was going to ask Dr. Mehta a question. Let's say that, since there is some question about how long it's going to last, is there any downside to, getting, like for me, getting my 5th dose, a booster? before 6 months after receiving Evusheld, does it affect the efficacy, the effectiveness of the booster if I were to do that?
We don't really have any data to raise that concern. And so, for patients who are in the middle of their various booster schedules we were talking about earlier, if you are several months out from when your next booster is due, it makes sense to go ahead and get Evusheld now if that's something that you want to pursue, to give you that extra layer of protection right now, especially because most of the country right now has significant cases in the community. And so same thing with, your question about the 5th dose, if to go ahead and get that on time, and then anytime 2 weeks after that, if it's time for another dose of Evusheld based on what we know at that time, to proceed accordingly. I will say one other thing, earlier we were talking about monoclonal antibodies in general, but something we've learned about the ones that have been used for treatment over the last year and a half now is that every time a new variant of COVID emerges, the existing monoclonal antibodies we have are tested against that variant to know if it's still effective. And that's why we've had so many different ones over the last more than 1 year that are sort of what we go to for treatment. And the same thing is a consideration for Evusheld, which we're using for prevention. So right now it has pretty good activity against this circulating strain or variant of COVID. But if another one were to emerge, which is not unlikely, we would need to see if it's still effective and or whether a different one would need to be developed for that.
I saw an article yesterday that suggested that Moderna, the new Moderna vaccine, might be more effective against Omicron. That there was a study that suggested that might be the best booster. Did you see that, or do you know about that?
Yeah, I think that I did see that, and I think one of the things that we also need more information around is how that might look depending on what vaccines people had as their prior doses and the number of doses. That's something that I would like to understand more as I recommend to patients which one to get for their next booster doses. The majority of my patients have received 3 or 4 doses already. But that is the kind of information that we need to know, what, both against the current variant, but as well as, where you are in your sequence of boosters and sort of what gives you that additional bang for your buck, so to speak.
Well, that actually segues into a question that we received from the audience. One person asked about the protectiveness against the Omicron variant for transplant recipients, and also the same question contained another question. Also, the dose was increased, they say, from 150 to 300 milligrams. What's the likelihood the recommendation dose will be increased again?
Right. So that dose recommendation was made, a couple of months ago. Based on what we're, the way that we learn whether something is helping or working is when we see if people are getting what we call breakthrough infections, meaning, despite receiving something for protection, if you get infection anyway, and if you do get infection, if it's, how mild or severe it is. And so far, at least what we've seen here in the New York area, there have not been a large number of cases in patients who've received Evusheld at the 300 milligram dose. I don't expect that dose to change in the near future.
Thank you. Here's a question that's, just kind of going back to basics. We have a question that asks, how exactly do you define immunocompromised?
Right. So an immunocompromised individual is someone who is either due to a medical condition that they may have or medications that they take has a weakened immune system. So certain medical conditions, such as certain types of cancer, certain autoimmune conditions, even what we call primary immunodeficiencies that someone can be born with, lead to a weakened immune system. And then treatments for those medical conditions, such as chemotherapy, or for other medical conditions, such as when patients have a transplant and they take those anti-rejection medicines we talked about earlier that weaken the immune system, can lead you to be immunocompromised. So you can be immunocompromised either due to a specific medical condition or due to treatments or a combination of both.
Thank you. So kind of related to that, but this is more about people who have just chronic illnesses, which can vary. The question is, COVID can be scary for people who have chronic illnesses. If you don't have a primary doctor to go to, who should a person or patient reach out to for more information?
So I strongly recommend that you try to have a primary doctor. Sometimes that might be your medical specialist, who may not be a general internist or a family practice doctor, but it might be your nephrologist or your cardiologist. Or your oncologist in the setting of someone who has cancer. So I think going to your main doctor to have these conversations, whether it be about Evusheld or what else you can do to protect yourself from COVID, and also knowing that you have a direct link to them and their team should you get exposed, should you test positive and need treatment, so that those things can be done promptly, because these therapies work best when given quickly after testing positive or after being exposed.
Thank you. We also have two questions about the Moderna vaccine. So one is it true the Moderna vaccine, besides Evusheld, I don't know if you don't have it, I'm not sure what they mean exactly, has the best rate of protection against COVID and those who have transplants?
So I think that's what we're seeing, what we were just talking about in terms of potentially having what we're just hearing about now about Moderna perhaps giving better protection against the current Omicron variant. So yes, that has emerged. I think that, again, in terms of if it's specifically in transplant patients, we need more information to really know if the degree to that it is better for Omicron is the same as in patients with normal immune systems. But generally, when we talk about protection against a variant, it's specific to the particular medication, or in this case, a vaccine, but the amount of benefit might be different for someone with a weakened immune system, just again, because their immune system can't mount a response to the vaccine often as well as someone with a normal immune system.
And I think, I think that there at various time points, there has been a putative benefit to Moderna because the mRNA is present at a much higher dose in the vaccine, and so there for someone who's immunosuppressed, that might be a benefit. And some of the transplant studies, there have been shown to be better results with Moderna as a result of that. So both how well it protects against different variants is important, but also the dose of mRNA that you get in the vaccine may also be beneficial.
Thank you. I think we may have time for one, maybe two questions from the audience. Let's see. One is, not sure about this one. Is it safe to accept a COVID positive kidney? I don't know if that means if the person currently has active COVID, the donor, or if the donors had COVID in some way.
Yeah, that's a great question. And, we just returned from our national meeting of the American Transplant Congress, where really a lot of great data that we'd already been hearing about was formally presented about how organs from donors who had COVID have been safely used for organ recipients, specifically non-lung transplant recipients. So that gets to this question in terms of receiving a kidney. So we have not seen transmission of COVID from a COVID positive donor to the recipient through a kidney transplant. There's a lot of specifics that we look at as a team when an organ offer is made from a donor that has tested positive for COVID. And that includes, what's known about, how recently the donor had COVID, which gets to, your talking about what this question might be asking. But many times patients still test positive for COVID even after they've gotten better clinically. And so if we don't feel that there's a high risk that they were just recently infected, we use those organs. And that's important as more and more of our population, has been exposed to or infected with COVID. And it's one of the things we've had to navigate over the last 2 years. And it's very reassuring to see that we're not seeing those transmissions from COVID positive donors.
Thank you. Dr. Montgomery, any comment on that question?
Yeah, it is a great question. And particularly, I think, a few months ago when we had a lot of Omicron and, a lot of our donors were testing positive, we would have missed a lot of opportunities for patients if we hadn't, really gone into that in a scientific way to look and see, how much we could sort of push that along to get more information about when it's safe to use a COVID positive donor. And, as Dr. Mehta said, it seems to be for kidneys anyway, pretty much for all the organs except lung. There has been a transmission and in lungs, not surprisingly, because that's where the infection occurs. And the only other thing, to really, this is something that your transplant physicians and surgeons will be looking at really carefully, not necessarily something for you to be worried about. But we also want to make sure that, the kidney, if the person died from COVID, was not really adversely affected by COVID. That happens in a minority of cases, but it can happen. There can be injury to the kidney from COVID. And so that's the other thing, we biopsy the kidney and really look very carefully and make sure that that's not a problem too. So there's both, the concern about transmission and also whether the organ has been affected by COVID.
Well, thank you so much. This has been a just tremendous session. There's so much uncertainty still around COVID, and people who are living with transplants and kidney disease have special considerations. So we thank you so much for taking time to answer audience questions and share your knowledge and expertise and concern with our audience. We very much appreciate that. As we close, last maybe 2.5 minutes, love to know your parting thoughts. Dr. Mehta, Dr. Montgomery, if there are just 2 things you want people to know about COVID and kidney disease and living with a transplant, what would you share with our audience?
I mean, I think a lot of people have really been, in isolation these last 2 years. And, I've talked to a lot of patients and, I think one has to be prudent. But I think it is also, a time when one should assess, the individual events that they're going to be involved in. If they're, going somewhere, if they're seeing their grandkids, to really kind of look at it and do some kind of assessment of risk. I think we're at that point now. So be prudent. But I think, we all need to some extent re-engage in life.
Thank you. Dr. Mehta, what are 2 things you want people to take away?
Yeah, my comment is in a similar vein, just to have the conversations, with your family, but also, your provider. One of the things that I enjoy doing, though I wish we weren't having to navigate this for as long as we have, is talking to patients about how they are getting back to normal and what are their concerns, and how can they safely do the things that are really important in life, because that is really a priority for everyone, whether it's work, whether it's, your child's wedding, and in being there for the important events and being there safely. And we've learned a lot, and there are ways to do these things. And so keep the conversation going with your providers, so that you can live life the way that you'd like to.
Great advice. Thank you both so much again for joining us. This was just tremendously valuable to everyone. Just a reminder, we still have more Kidney Action Week content coming up. Stay tuned for a Kidney Kitchen cooking demonstration, and the next session, Living with Autosomal Dominant Polycystic Kidney Disease, known as ADPKD, is also coming up later this afternoon. If you haven't already, please send us your email through Facebook or through kidneyfund.org. We also have a quick session, an evaluation survey at the end of this session. We love your feedback. It helps us to be able to plan better for next year. It's in the green button, so please fill that out for us. We really appreciate it. Thank you so much and have a great day.